8:12 now, Thursday morning, February 4th. We are into February, which is Heart Health Month, as more people are surviving heart attacks but being left with weakened hearts. Heart failure is a major cardiovascular disorder that's on the rise. It affects nearly 5.8 million Americans, and that's a lot of people. Dr. B joins us now, our friend Dr. Brent Wallis from People's Health, to discuss it. Hey, Doc, how are you?
Hey, Tommy, I'm doing great. How about you?
Good, and good to hear from you as always. What is heart failure?
Sure. I mean, heart failure is a pretty scary term to use, and so sometimes we may describe it as an enlarged heart, sometimes a heart with a little bit of damage, or a weakened heart. And, you know, a lot of people don't understand what it truly means. It's really not from a sudden event like a heart attack. A lot of people understand what a heart attack is, but it's really not the same as that. Heart failure really occurs over a long period of time. It's not a sudden event. It's typically not painful either, but it's really just a progressive weakening of the heart muscle. And, you know, the heart muscle is what pumps blood all throughout your body. So heart failure is really a chronic disease, like a lot of the ones that we see. When the heart can't pump well enough, that means you can't get blood to all of the parts of your body that need to get blood. And it's usually from an injury or some sort of damage to the heart muscle. So what happens is the non-damaged parts of the heart have to squeeze harder and work harder to pump all of that blood around. And because of that extra work they're doing, they can either become enlarged or sometimes stretched out, kind of like a balloon. And so, again, it doesn't mean that the heart suddenly stopped working or that you're suddenly going to die. And it's definitely not a death sentence. You can live with heart failure, and millions of people do every day. You just have to really work with your doctors and your healthcare team so you can actually feel better and actually make your heart work a little bit better.
It can sound scary, though. What causes heart failure?
So heart failure is really, you know, it's a disease caused by a lot of other diseases. And so some of the things that we worry about that can lead to heart failure is definitely heart attack is one of the biggest ones. So when you have damage to the heart muscle, that can later result in some heart failure. But another thing we see quite often is heart arrhythmias. That's something called atrial fibrillation is very common. So if the heart is not beating in synchrony, you know, it's not being very effective, and that can lead to some heart failure type symptoms. Really, probably the most common, though, is high blood pressure, and there's so many people in the world with high blood pressure that increased pressure that the heart has to work against can cause it to enlarge, and that can actually lead to heart failure. And then a couple of other things we really watch for: high cholesterol can affect you because that can cause blockage in the arteries, any sort of damage to your heart valves. And then something particularly in Louisiana we see quite often, people with diabetes can have anywhere from a 2 to 8 times greater risk of heart failure than those people without diabetes. It does tend to happen as you get older. The heart gets a little bit weaker as we get older, so it's actually the most frequent cause of hospitalization in our senior population. And then one in particular to keep in mind is really excessive alcohol consumption can actually lead to some damage to the heart muscle, and that can result in heart failure as well.
When you say blood pressure, is that, I always get confused, is that if it's uncontrolled, or if you're taking medication that controls your blood pressure and keeps it normal, then do you not have the risk of heart failure?
Yeah, definitely. You know, the uncontrolled high blood pressure is what causes the damage to the heart. So that's why it's even more important to take your blood pressure medicine and keep that blood pressure under control so that it doesn't progress to heart failure later in life.
What are some of the symptoms of heart failure?
Yeah, so there's a lot of symptoms that come, and they typically come on kind of gradually over time. So people may think that they're just a part of normal aging, but they're definitely not. And we use a little mnemonic to remember these. It's called FACES, F-A-C-E-S. And so, excuse me, the F stands for fatigue or tiredness. People with heart failure, because the blood's not pumping correctly, can feel very fatigued with very little activity. The A really stands for activity. What people do is because of that fatigue, they start to limit their activity, limit what they're doing. They develop kind of an inability to exercise and feel weak when they're doing things. The C is chest congestion or cough. A lot of people with heart failure cough because they're not really able to clear their lungs of the blood that's being pumped through it, and so their body is reacting by trying to kind of open your lungs up a little bit. The E is edema, which is really a fancy word for swelling. So a lot of people who develop swelling in their lower extremities, kind of around the ankles and the shin area, that can be a sign of heart failure as well. And then the last one is S, which is for shortness of breath. So most people with heart failure that's not well controlled can develop shortness of breath with very little activity. Some can actually even wake up from sleep feeling like they can't catch your breath. So if you have any of those symptoms, you definitely should talk to your doctor about, could this be heart failure?
Is that what they call, I don't know, putty legs or something, where people press their shins and it like leaves an impression of their fingers? Is that an indication in and of itself that you should consult a physician?
Exactly. It's called pitting. It's when we push our thumb into your leg and it leaves a little dent there. And it is important to keep in mind that there are some other conditions that can cause that pitting or swelling in your legs, but heart failure is definitely one of the most common.
So have it checked out.
Definitely.
All right. We're going to take a break. When we come back, we'll talk about how do you know if you have heart failure and treating it, et cetera. Dr. B is our guest, Dr. Brent Wallis. He's the Chief Medical Officer of People's Health. Of course, you can always go to peopleshealth.com/radio. Find out more. You can follow him on Facebook, Twitter, or Instagram, and you can call 866-687-7335. And there's also a virtual presentation coming up we'll tell you about as it relates to heart failure. That's what we're discussing this morning with Dr. B from People's Health. 8:20, time for traffic, WWL. I'm Tommy Tucker, WWL, talking to Dr. B on this Thursday morning, as we normally do. He's the Chief Medical Officer of People's Health, and we talk about senior health. It's February 4th. February happens to be Heart Health Month, and we've been talking about heart failure and an acronym that you can remember that kind of, I guess, shows the warning signs. It's called FACES. F stands for fatigue or tiredness. A stands for activity becoming limited or reduced. C stands for chest congestion or cough. E stands for edema or swelling in your ankles. S stands for shortness of breath. So, Dr. B, when it comes to, I guess, diagnosing heart failure, and we were talking about pitting in the legs before, how do you determine, or how do doctors determine if you have heart failure?
Sure. You know, your doctor is the one that's going to be able to tell you. There's nothing you can actually do to determine whether or not you have heart failure. And what we do, so we do a thorough physical exam. You mentioned the pitting, which is definitely a sign. We're going to listen to your heart. We may actually look at the veins in your neck as well that can give us an indication of maybe too much fluid that's in your body. So really a comprehensive medical exam and then a history is important. But we do have a couple of tools, some diagnostic tools that are very easy, that are very important, that we use to make the diagnosis. The one of the most important ones is something called an echocardiogram. And really, that's just a fancy term for an ultrasound of your heart. And it's a very quick, easy, painless test that we can do in the office. We put a little bit of cold jelly on your chest, and we can actually look at the heart and see how it's functioning. And what we're doing when we do that is we're trying to determine how well your heart is squeezing and how much blood it's able to pump out with each beat. And that allows us to calculate something called an ejection fraction. And it's complex, but essentially an ejection fraction is how efficiently your heart is beating. And every time it beats, it should be able to squeeze out about 55% or so, sometimes a little more, of the blood that's in it. If that starts to drop down below 55%, especially when it gets down to 40% or so, that means too much blood is backing up in the heart, and that can result in a lot of these symptoms that we're talking about. One of the other tests that a lot of people have probably heard of and had is called a EKG, or sometimes an ECG. That's an electrocardiogram, and that's actually another painless test where we put little sticky pads all over your body, on your limbs and on your chest, and it allows us to look at the electrical activity in your heart. But what it really does for us is it tells us how effectively your heart is beating. Is that beat regular in nature? And then it also can give us an idea about the size of your heart. I'd mentioned about the enlargement that you can sometimes get with congestive heart failure. And then the last thing we do is a chest X-ray, and the chest X-ray gives us a nice picture, tells us how big your heart is in relation to the other organs that are in your chest, and that can sometimes give us an indication of what's going on. It also allows us to look at your lungs, so if you're having shortness of breath, is it related to congestive heart failure, or is it something else that's going on? There aren't fantastic blood tests for congestive heart failure. We do have one in particular that's called a BNP that we use to kind of decide whether or not the symptoms you're having are related to something going on in your lungs or if it's something related to your heart. But unfortunately, we don't have a real clear blood test that can say, yeah, you definitely have heart failure. You've got to have these other tests and that exam by your doctor.
So you said earlier it's not a death sentence. What steps can somebody take to kind of manage heart failure?
Yeah, like we said, there's millions of people that live with heart failure, and you certainly can, but there's a couple of things that you really need to do. The most important is identify it and understand what it is and make sure that you're talking with your doctor regularly, that you're going to your visits. Heart failure is not something you want to see your doctor once a year for. You're going to have to go see your doctor probably several times a year, and especially if you develop any worsening symptoms. One of the things that's real important is your diet, and in particular your salt intake. So when you eat salt, it actually makes you retain fluid. And when you retain that fluid, that actually builds up the volume of blood in your body, and it makes the heart's job harder because it's got to pump a greater amount around your body in order to work. So reducing your salt intake can really help to get your heart failure under control. We see a lot of times, especially this time of year when crawfish starts coming out and people, go out and celebrate, and they can actually have an exacerbation of their heart failure just because they've consumed too much salt. We have a lot of medications that can be used, and those medications are critical. They're a major part of the treatment. And just like we were talking about with hypertension, what's key is that you have to take these medicines daily. You have to keep your blood pressure well controlled, and that's going to help your heart failure symptoms and ultimately help you live a longer, healthier life.
And exercise, very important as well. You guys got a virtual presentation coming up. Tell us about it, Doc.
Yeah, we do. So we're actually doing a presentation called How to Love Your Heart. It's going to be next Wednesday on February 10th at 10 o'clock in the morning. And it's going to be virtual and free. You can sign up for it at peopleshealth.com/heart. So I hope people come out and see us.
And taste the food before you salt it, please.
Definitely.
Thank you, Doc. Thank you. Have a great week. Dr.
You
Brent
too.
Wallis, you bet. Dr. B, Chief Medical Officer of People's Health. You can go to peopleshealth.com/radio. Find out more. You can call 866-687-7335. And, of course, follow People's Health on Facebook, Twitter, or Instagram. 8:30 time for Instagram.